questions should patients ask about their test results?
Yeah, so I think first and foremost, just getting an understanding of what tests your doctor is sending is really important. This should be an open conversation, and it's a conversation that you should actually have as you are going throughout your cancer journey. It's not just a conversation at, your diagnosis. It's something that, if your cancer comes back, it should be reassessed. Are there additional markers that we should send that we didn't send in the upfront setting? Do we have a sort of complete picture of my cancer? And so I think that is definitely a question to ask, is what tests are you sending? And what is the outcome of those tests, right? How would that test change your potential management or change the options that you have for me in terms of my cancer treatment? The other thing that I will say that I think can be confusing for patients as we think about the genomics and genetics of a cancer is that it's really important to understand the difference between something called germline and something called somatic testing. And so I'm going to explain that because I think it can be confusing. The first, germline, is a test that is testing kind of the genetics of a whole body, so of a person, to see if there's anything that's hereditary that might have predisposed them to getting cancer. And so that is something that if it is abnormal, it may mean that family members need to get tested, and there are things that we can do to try and prevent cancers for other people in your family that might be at risk. So that is germline testing. That's different than somatic testing. Somatic testing is when we test the tumor itself to understand what about this tumor allowed it to become abnormal, allowed it to kind of grow abnormally and keep growing the way cancer does. And both of those are really important. So I think as you ask your doctor, what tests are you sending? It's important to ask about tests in both of those categories.